Well, more than 300,000 Americans are expected to be diagnosed with breast cancer this year alone.
Breast cancer is the most common form of cancer in women. And with October being Breast Cancer Awareness Month, we have invited Dr.Soudabeh Fazeli, the Diagnostic Radiologist from UC San Diego Health, to come talk about it. So thank you so much for joining us.
Thank you so much for having me. You know, this is something that I'm truly passionate about, so I'm very excited to be here with you guys.
We appreciate all the insight and expertise that you can bring us. So let's just talk about breast cancer as a whole.
Absolutely.
It is the most common cancer in women. It can also be diagnosed in men. Talk a little bit about the importance of everybody kind of being aware of it and understanding it.
Absolutely. So as you guys mentioned, it's very common. So just to give you an idea, about 1 in 8 women are diagnosed with breast cancer at some time in their lifetime, which is a huge number. I think everybody knows a family or a friend who has been affected by, this disease. The good news, though, is that, and I'm a radiologist, so I'm a little bit biased here, but the good news is we have this wonderful imaging tool called screening mammogram, which can help us detect breast cancer, very early on. When treatment options are most effective. So I'm here today, basically, to emphasize the life-saving importance of screening mammography.
Yeah, let's talk about that. It really increases survival rate because that's really what it's about, is finding it early and finding options to treat it.
Absolutely. So breast cancer, if it's detected early, it's pretty much curable. So there's a term called 5-year survival rate that we use in medicine a lot. And what it means is that if you're diagnosed with, for example, breast cancer, if we follow you to 5 years, are you going to be still with us? And if breast cancer is diagnosed early, about 99 out of 100 women who are diagnosed with that stage of breast cancer are going to make it to 5-year, time period. And most of them are going to be cured and they're going to live forever. So the only way to do that, though, is if we get that screening mammogram.
Yeah. Let's talk about screening, because you were telling us that the screenings now happen as young as 25.
It can.
How has that changed? Like, what is the recommendation, I guess, from doctors, and how has that changed over the years?
Of course. So I really wanted to actually mention this because there has been a bit of a confusion about the screening age, because different organizations have put out different guidelines in the past few years. But with increasing incidence of breast cancer among young women, especially between 40 to 49, now pretty much all organizations agree that we have to start screening at age 40 in women who are at average risk for breast cancer. Okay. So everybody get that screening done if you're 40 or older.
But if you have the risk, and that's the key, isn't it? That's when you should start early, or some sort of genetic component.
Exactly. So if you are not average risk, if you are high risk for breast cancer, and that include, as you mentioned, some genetic mutations, if you have a very strong family history of breast cancer, if as a kid you had lymphoma and had radiation to chest, those are all risk factors. Then you may qualify to start screening as early as 25 years old. So what we encourage everybody to do is to start having these discussions as early as possible, even in your 20s. Talk to your doctor, talk to your primary care or OB/GYN doctor if you don't have a primary care yet, because a lot of young people don't. And have those discussions so they can evaluate your risk and identify you if you are among those high-risk populations, so we can start you on that screening at age 25 or 30.
Talk about the differences in screening too. I mean, because for a lot of women, it's always just been mammograms, but now you have those MRIs.
Yes.
What is the difference?
So not only we have MRIs, and I'm very excited that you asked that question, we have so many different techniques now. So something that recently came out as, was discussed is the dense breast law, dense breast notification law. So I really wanted to mention that because that has been a point of confusion and anxiety for a lot of women. So about half of women have dense breast tissue. And, it's not a point of concern. It's very common. However, it tells us that mammogram may be a little bit more limited for, detection of those early breast cancers. And that's when other, modalities such as you mentioned, MRI, ultrasound, or the other things that I was going to talk about, basically come into play. So the modality I really wanted to mention today, because I think a lot of women are not aware of, is a 3D mammogram, also called tomosynthesis, which is widely available. And it's going to help us detect those breast cancers, especially in those women who have dense breast tissue. So most breast imaging facilities offer that, but not all. So if you are one of those women who have dense breast tissue, I highly recommend when you're making your screening appointment, just ask that question and make sure you are offered that technology.
So you have to be your own advocate to make sure that you're getting the tests and the treatments that are available to us. You mentioned that the number of people who have breast cancer has increased between 40 and 49.
Yes.
What's causing that, and how, over what period of time is that happening?
You know, we've been noticing that in our practice, but you always think that maybe you're noticing it because you don't want those young women to have breast cancer. But there have been recent publications, one of them actually came out just last year, showing that the data is real. We don't know exactly why, we can't explain it, but we know that this is happening. And we know that young women, when they do have breast cancer, it's usually a more invasive and aggressive subtype. So we really want to catch those early on. And that's why I really want to emphasize getting those mammograms, at least beginning of
Are there any
age
other
40.
cancers in addition to breast cancer that have seen younger people getting it?
I want to say that I'm a breast specialist, but I know that this is also true for colon cancer. So I don't know what's happening, but we have to watch out and we have to be advocate for our own health.
We absolutely have to be. Ask the questions, pay attention, check for changes. Those are all important things, especially during the month of October. Thank you so much for coming in. We appreciate you.
Thank you so much for having me.
All right.